Medicare Telehealth benefits might very well expire in September of this year, which is taking everyone by storm. If you rely on virtual doctor visits, you need to watch this. We're covering what you need to know before the potential deadline. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am sipping on a ginger fizz mocktail. Before we get into what's happening with telehealth and what you can do about it, I love to hear from you all. Do you currently use telehealth? If so, what has your experience been? I can tell you that I personally use it for both myself and my kids. It's been a lifesaver with pink eye and things like that, but let us know what you think. So before we get started, I know not everyone knows. So really, what is telehealth? So essentially, telehealth is a virtual doctor visit from home. It's helpful for those that live in rural areas, have mobility issues, maybe those that don't have transportation or no longer drive. And frankly, over the last few years, it's helpful for those who don't want to be around sick people in a waiting room. I know a lot of times it's something you would do on your phone, on FaceTime or something similar to that. So, telehealth, kind of how I just mentioned, telehealth really shot up in popularity during COVID. So 42% of Medicare outpatient visits are conducted via telehealth, and that's from the Cardiology Advisor. 80% of physicians use telehealth as an option in 2022, and that's from the American Medical Association. Medicare had strict limits prior to COVID, and then everything was lifted and extended when COVID came. They realized that, a lot of doctors feel like for certain types of telehealth visits, it's quite helpful, but obviously not everything can be done via telehealth. So it's currently extended through September 30th of 2025. So what will happen to telehealth on October 1st if this isn't extended? So a few things to note here. Patients currently using telehealth will need to find a medical office or facility. If you're using some type of telehealth for your primary interaction with your doctor, you're going to have to find an in-person doctor. Next, private insurance, they often follow Medicare's lead. So if we do see this not extended from a Medicare side of things, it'll likely be that we do see a ripple impact on employer health insurance and other private insurance. Additionally, hospitals and doctors will scramble to find alternatives. If they had a large sum of people that were utilizing telehealth and not coming to the office, now they have all of these people coming to the office, it could really create a backlog and become an issue. I know I mentioned earlier that when I've had kids with pink eye, I've done telehealth and it's quick and easy and we can just go to the pharmacy then. But if we were going to have to go to the doctor, we'd have to schedule that appointment and it would just back things up a little bit. And the other note, I think this is an interesting one. So doctors will have to be licensed in the same state as the patients. This was one thing that was relaxed during COVID. They used to allow, say you're in Indiana and your doctor's in Ohio, they used to allow things like that. But that will be changed come October 1st if there is no extension of this. So cheers, let's talk about exceptions because everyone knows that every rule has exceptions. So what are the exceptions for this one? So if you are not in a rural healthcare setting, there are still some options if, number one, you have end-stage renal disease and are required to have monthly visits for home dialysis. 2, acute stroke care. 3, services for diagnosis, evaluation, or treatment of a mental and or behavioral health disorder in your home. And last but not least, this does include substance abuse. So these are things that would fall into an exception. Now, something that I think is important to mention here is that this is for original Medicare and Medicare supplement plans or Medigap plans. We have lots of videos about the difference between original Medicare, Medigap, supplements, which are the same, and Medicare Advantage plans. Now, let's switch gears very briefly here and talk about the impact that this will have on Medicare Advantage. So MA plans do offer more health benefits than original Medicare. The way that these were changed in 2010 is they had to at least offer the same standards as original Medicare, but then most of them, in fact, all that I've really seen, do go further and offer additional benefits. So they may keep the telehealth benefits regardless of this policy changes. And the coverage really does vary by plans. For years prior to COVID, even, a lot of these plans included additional telehealth benefits. So we're anticipating that that will continue. We always recommend when we talk about changes to Medicare Advantage is check your annual notification of change, or known as an ANOC. Those are typically mailed out in the middle of September. You'll receive them prior to October 1. So just keep your eyes peeled. You might be getting an email, but most of the time those do come in the mail. And check with your plan to see if telehealth will still be covered. Like I said earlier, I would anticipate on the Medicare Advantage side, we'll still see this around for a while just because it's been an option for a while. So at the end of the day, Medicare telehealth coverage will change unless Congress acts. We have until the end of September to see sort of what they're thinking and what happens with that. As I just said with Medicare Advantage, I would anticipate that those telehealth options will be extended, but frankly, we'll see. There's a lot of uncertainty. Review your current coverage, give us a call. Do you use telehealth? If it's important to you, give us a call and let's go ahead and figure it out together.